Hello, everyone, and welcome back to the last installment in BFSG's 2025 summer webinar series, today covering Social Security and Medicare. We have three great presenters from our team today, Scott Solers, Henry Van Buskirk, and Arash Navi. You three, you want to move it to the next slide and give a little intro on yourselves?
Yeah, no problem. So I'm Henry Van Buskirk. I construct and monitor financial plans for our wealth management clients and our business owner clients, and well as employee participants, and make sure that they meet their financial goals. I also sit on the investment committee at BFSG, where we meet weekly to make those portfolio management decisions for our wealth management clients. Happy to be here, and thank you for taking the time.
Hi, my
Thanks,
name is
Arash.
Arash. I'm a CPA, certified financial planner here at BFSG. I help clients with tax planning, financial planning, and managing their investment portfolios to meet their retirement goals. I hope our audience finds this session informative. These are two important components of retirement for most people.
And good morning or good afternoon, depending on your location. My name is Scott Solers. I'm a senior wealth manager here at BFSG, also a certified financial planner and accredited investment fiduciary. I work out of the Phoenix office and been with BFSG for a couple of years and in the industry for about 25. So happy to be here as well with Arash and Henry. All right, so let's get started. So Social Security benefits initially were said to be a three-legged stool consisting of Social Security, pension, and savings and investments. And you know, the metaphor was intended to convey the idea that Social Security, and as we approach this pre-retirement income and providing income stability and security in retirement. But unfortunately, over time, pensions, as you all may know, have gone by the wayside. So certainly is a greater dependence on savings and investment. As of the end of last year, Social Security reported that there's over 68 million individuals receiving some type of Social Security payments. And obviously, Social Security has become an integral piece to financial consideration for most Americans. As of December 31st of last year, 86% of those in the population age 65 or greater were receiving Social Security benefits. And then 92% of individuals age 75 are receiving Social Security benefits. A lot of folks receiving Social Security. This is a busy chart, so we're going to focus on really three areas, but primarily the green and the blue section. And then on the bottom row, you can see annual income amounts. But for all retired workers, the average monthly Social Security benefit is a little over $1,900 per month. Many people who just rely on Social Security when they reach retirement may have a shortfall in meeting their overall expenses. Lower earners, and this is those that are on the left side of the chart, they receive a greater percentage of their pre-retirement income than higher earners as we get closer to the right side of the chart. So you can see the green is what we're referring to here. For those higher wage earners, in particular those that have exceeded the Social Security wage base, which is a little over $176,000 a year, that will replace a much smaller percentage of their wages. For 2025, the maximum amount you're able to receive for Social Security payments is $5,108. So let's use an example of someone who's at the $100,000 pre-retirement income. So right in the middle there, you'll see that Social Security replaces about 1/3 or 33% of their income. And so what that means is they have about 43% that they need to make up with other sources, in particular with savings and investments.
Is it just because I like to, can you go back to that? I feel like with you, we always like to explain it as simple as possible. That's a great explanation. But at the top left, no, this is household income. So, that the $100,000 income that Scott mentioned is not an individual making that. That is, say both partners in the relationship made $50,000. That was their pre-retirement income. And you're saying Social Security for that household, which I'd say is a relatively modest income for most people nationwide. I mean, California, hard to live on that in a household. New York, same thing. But maybe, Idaho or Texas or Arizona may be a little easier. But for that, couple right there, they're going to need 43%. That's $43,000 a year to come from their own accounts, be that their pension accounts or their 401k or other savings. Only $33,000 a year is going to come from Social Security for that particular household example, right? And obviously you have, lower income households on the left and higher income households on the right. And I think where Scott alluded to, for a household where maybe both partners make $150,000, you could only count on still around that $40,000 mark to come from Social Security, but your pre-retirement base was a lot higher, right? Triple that. And you're going to get just a little bit more money from Social Security in that example. So just things to think about as you walk through that slide, income on the bottom.
Yeah, great. Thanks for pointing that out as well. An important distinction there. So here, let's talk about estimated benefits and how we qualify for Social Security. So in order to qualify, you have to have 40 credits of coverage. And so it's not possible to earn more than 4 credits in any given year, no matter how much you make. For 2025, the income threshold to earn 1 quarter is $1,810. So if we annualize that amount, $7,240 you have to earn, and then for 10 years, right? There's 4 quarters in a year. To get to 40, you got to go 10 years to fully qualify for Social Security. When you get there, what Social Security does to provide the estimated benefits that we'll get here momentarily on is they'll take your best 35 years and then drop your lowest 5, and they'll use that calculation to determine what those benefits are. It's always possible to increase your benefit by improving your earnings record. So even after you've started receiving the benefit, or if you're delaying, if you're able to knock off one of those zeros or low earning years, your benefit may go up a few dollars a month. So it's certainly important to check that out and as well as make sure it's accurate. On the right here, so your Social Security benefit statement predominantly now is online, and this is what it'll look like for you. It'll show your earnings record and then estimated benefits at various ages. Again, it's important to review those statements to make sure there are no zeros or errors that would reduce your benefits. And if you find one, bring your W-2 or proof to Social Security and they'll adjust it accordingly. The Social Security website also has a benefit calculator to help you estimate what your Social Security benefit amount would be at those various ages. But a couple of important points here that we should also touch on. One is, if you do find an error, the Social Security Administration recommends that you wait no more than 3 years from that date so that you can provide proof and they can make an adjustment. And that's important because they only will pay 6 months in arrears. Excuse me, 6 months in arrears. So don't forget to show that right away if you're right on the age of taking those benefits. The benefit calculator estimator can be used as long as you have 40 credit hours of coverage and don't have a pending Social Security or Medicare application, and you're not receiving Social Security benefits currently under yours or someone else's record. And then we'll talk about something coming up as well, but one other way that it won't provide a lot of information for you is if you qualify or subject to the Windfall Elimination Provision. And I think Henry will touch on that here momentarily.
Yeah, so can you touch on how many quarters do you have to have worked to even be able to claim benefits in the first place? I think is an important thing that we want to make sure people have, especially since we're going to have governmental employees, and does all their work experience apply to that stuff too? But even just somebody that, may not have worked because they, stayed at home, raised a family, which is honestly probably the harder job. But then later in life decided to go back to work when their kids were off in college. How long does somebody need to work? And then what happens secondary to that if you have less than 30 years working in retirement? Like, what do they do with those 0 income years?
Yeah, perfect. Thank you. So 10 years or 40 quarters, however long it takes you to get 40 quarters is what the initial threshold is to be eligible. So whether that's you work for 5 years, full year, make over the $7,240 threshold, you raise children for 10 years and you come back, you'd have to work another 5 years at 4 quarters a year in order to be eligible for the minimum threshold. As far as the zeros, what those zeros do, again, it's all part of your calculation, your 35-year calculation. And in that example that I just gave, if you did step away for 10 years to raise children or whatever the reason might be, they'll drop 5 of those because it'll be your lowest amounts. But then as you resume working, that 30 year is not sequential in the sense that it doesn't have to be consecutive 30 years. They'll look at your entire record. So let's say it's 40 years and you took 10 years away. They'll look at the highest paying amounts for 30 years or 35, and then they'll drop 5 of the lowest. Okay, so I hope that there's a lot of numbers there, but I hope that is clear. Okay, and then Chad, let me kick it over to you. Again, there's the website, ssa.gov. Chad, let me kick it over to you because there's a poll that we'd like for you all to answer.
I love it. Thank you, sir. The question here is, what age do you plan to start collecting Social Security benefits? And again, this is just our team getting to know who's on the call, getting an idea for people wanting to take it early, wanting to take it late, or just expecting to take it right on time. And the last one's just my cherry picked. I always like to put a fun one in there because my favorite way to plan for Social Security is to plan it for it not to exist, because then I'm not relying on it, and hopefully that means I'm going to save a lot more. So we'll get to that question too. What happened at age 65? So let me stop sharing. I think most people have responded here, and I'll share results for the group too. Let me put it on the screen. I'll also verbalize it for anybody on the phone. About 14% of people here say they're going to collect it at 62. About half the people, 52%, say full retirement age, which is age 66 and 67. We have a question for all of you. What happened at age 65? Like, didn't that used to be a thing? And when did it move to 66 and 67 based on when you were born? About a quarter of the people, or 27%, say they're going to wait till age 70. And then, about 7% of people say it's probably not going to exist. So why are we talking about it? I love it. So before we get into this, can you guys just address like what happened at age 65? Like now it is full retirement age at 66. Like how many people still qualify for 65? Is that even still a thing for people that are working, or is everybody past 65 now?
This is a great segue to the next slide, Chad. This is the very next topic.
Couldn't beat it. All right, let me stop sharing results and give it back to you.
Wonderful. So let's talk about eligibility and retirement age. So the Social Security Amendments Act of 1983 increased full retirement age from age 65 to age 67 over a 40-year period. So this first phase of the transition increased full retirement age to 66, and then that was for people who turned that were turning 62 between the years 2000 and 2005. Then there was an 11-year hiatus, and then the transition from 66 to 67 happened. So let's just focus on the left side of the chart first. So this is by birth year and what age you are then determined to be full retirement age. So 66 is a little bit more complicated because it's 66 in some years, and then 66 in 2 months, and then 4 months, and 6 months, and so forth, until your birth year is 1960 and later, and then it turns to age 67 for everyone else. We'll focus on the right side of the chart as well, but the age at which one claims Social Security affects the amount of benefits received, and this is really what we're looking at on the right side of the chart. So again, the key claiming ages are 62, full retirement age, and then age 70. So surprisingly few Americans understand the benefits and trade-offs related to claiming Social Security at various ages. And so what the right graphic illustrates is the results in when you take those, what those trade-offs are depending on what age you take them. So let's just look at the far right column and look at age 67 as the example. So waiting till age 70, which is the very bottom row, it results in a 24% increase in your benefit check. Then taking it at age 67, which was where 100% of your benefit would be. So as the years go on, there's about an 8% increase each year from 67 to 70. An increase annually, and that's how we get to 124% of age 67. Okay. And so likewise, if you take benefits early, so if you look at the top row there on the right chart, age 62, you see that you only receive 70% of what you would receive if you waited till age 67. Okay, so again, there's some trade-offs, and we'll talk about next, like, how do you know? How do you know when to take it? And I'm going to show all of these at one time, but the answer is, it just kind of depends on you and the situation. So if we look at this page, we're looking at the break-even point based upon what age you elect to receive Social Security, relative to, we're using full retirement age of 66, and then, of course, the maximum age 70. So, one consideration is factoring the break-even age, and what does longevity look like for you, in particular with your family. So if we look at the yellow line and the green line, right, they intersect at age 67. So if you start taking benefits there, kind of your break-even point is going to be right there at 77. And then likewise, if you take it at age 70, your break-even point is going to be at age 81. So if you have longevity, maybe a consideration to factor in, well, maybe I wait till 70. And if I anticipate living past 81, then you come out ahead, if you will, using that model.
Hmm.
Let me pause there.
Yeah, and really what we're alluding to here is there's that uncertainty that drives people to be less confident in understanding when do I file for Social Security? How do I file for it? Because there's one thing the financial plan can't solve for. How long are you going to live? So looking into the next slide, we're going to discuss how we can best optimize our Social Security benefit.
Before you move on, could we
Yeah.
define break even again? Yeah, I think, and as Scott said, let me say it in a little bit
Sure.
different words too. Like, the idea here is, that yellow line is assuming that you took your benefit age 62. The call it tealish line, although it's the green text at the bottom of the page, but that darker blue line is saying, well, for somebody that waited to age 66, the amount of money you would have received from the Social Security Trust Fund will even out. So say between 62 and 66, you've been claiming already for 4 years. Maybe you got $100,000 from the Social Security Trust. Somebody that waited till age 66 did not claim for that 4 years. But by age 77, because they get a higher benefit, because they're getting that 100% of their benefit, they would have accumulated the exact same amount of money from the Social Security Trust. And so for every day past age 66 that person that waited till full retirement age waits, they technically came ahead from a total cumulative dollar amount that they took away from Social Security Trust. Now, age 70 says, well, what if somebody waited 4 more years till age 70 because they get 132% of their total benefit, right? So now they didn't claim for 8 years. Like, somebody else was literally taking money from the trust for 8 years if they age 62, and for 4 years if they took it at age 66. That person that still waited that entire time till age 70, by the time they reached age 81, would have taken the total exact same dollar amount as the person that started taking at age 66, right? And so now that's where Scott mentioned, if you happen to live even a month past age 81, right, or make it till age 82, from a dollar perspective, you would have been better off waiting till age 70. Now, there's a lot of other factors that go into that, and I think our team's going to talk about that. If waiting 8 years means you deplete your entire 401k balance, and now you can only take Social Security, it might not have been the best decision to wait, right? Maybe you are married and your spouse, earns more money than you, right? And when they pass away, if they are going to pass away earlier, you're going to get a piece of their benefit. And doing the analysis of which is bigger, there's a lot of other things to think about there. So let me give it back to our financial planners instead of me blabbing, and they can get to some of those things.
Yeah, Henry, if I may step in just real quick and just
Yeah, of course.
expand on
Yeah.
Chad's point as well, is again, this, for the group, this is one strategy, and there's a number of strategies. Chad threw out another, and I'll just give you another, right, to show you it's not necessarily an easy answer or problem to solve, but that's why we have to weigh a number of factors. But just another example is, if you have a spouse and it was a lower age earning spouse, another strategy might be, well, gosh, if I have an income gap early, right after retirement, I might have my spouse with a lower earning amount begin taking the Social Security payment now to help bridge that gap until the higher earner then possibly can wait till full retirement age or age 70. And then that way they can increase their benefit amount if the gap is filled. So you just heard three different examples of considerations for it. So Henry, just wanted to make that point, and it's all yours now.
Yeah, definitely. And thank you both for clarifying all of that. Definitely appreciate that. And what we're pointing out too is the individual has to consider things like their family health history, their own health history, your cash flow needs, your income sources, and your marital status when you're considering what option is right for you. And if you can wait until at least full retirement age, then we recommend doing that. And here's why. As we pointed out before, full retirement age, or FRA, as you see on your screen here, is when Social Security says you're entitled to 100% of your Social Security income benefit. And we pointed out that each year you wait after that, if you can defer until age 70, which is that max, you're getting 8% guaranteed growth on your income permanently for the rest of your life. None of us on the call can guarantee that kind of rate of return. Take that all day long if you can. And on the flip side, if you need the money before full retirement age, by all means, take it. If you have some credit card debt you need to get rid of or a mortgage balance you don't want to see anymore, then we can definitely talk about strategy. What's going on when you do that is you're losing out on that guaranteed growth. It's about 8% less per year, as we illustrated in an earlier slide. And that's just because Social Security has to pay out for a longer period of time. For married couples, we have to consider both persons in the household before discussing claiming strategies. And spouses are entitled to either one, their own benefit, or two, 50% of the higher earner's benefit capped at that full retirement age amount. There's some nuances for married couples as well, such as how long they've been married. And if there's an age gap in the relationship, then that necessitates some different planning strategies as well. And the survivor benefit, it's a little bit more nuanced in how it works. The Social Security Administration, they're not going to notify you and email you, text you, whatever means to let you know of your eligibility for survivor benefits. Typically, you have to reach out to them directly, and you can collect typically as early as age 60, but what I'm alluding to here, it's a very case-by-case basis, and you have to be proactive in reaching out to them on what makes sense. And on an earlier slide, we were talking about the 40 quarters of coverage. Just take a hypothetical and say you have 39 credits. You're one credit shy of being eligible to collect income on Social Security. How about you get a little creative? Maybe you love babysitting your granddaughter or grandson, but you're a little tired of being a charity to do that, and you want to turn that into a little bit of a business, get about $700 a month in income. Because we pointed out, and Scott talked about, that income threshold is pretty low to get that last quarter of coverage. There's also some fun tax planning strategies around that, but that's a little bit about above the scope of this call. So if you're interested in something like that or being more creative in how you can optimize your benefits, definitely happy to take that offline as well. So let's transition to the next slide and talk about everybody's favorite subject, taxes. How does Social Security get taxed? They look at your combined income, which is pretty close to your adjusted gross income, but it adds back things like non-taxable interest. So think things like municipal bonds, and it's going to add back half of your Social Security benefits. And as you see on the table on the right-hand corner, what makes the threshold for 85% of your Social Security benefit taxable at the federal level is pretty low. And I stress the word federal almost comically, just to stress the point that there are some states, including California, by the way, that do not tax Social Security benefits. So double check what your state's rules are. There might be some states where they don't tax retirement or pension income, or you might be in one state like Texas or Florida, which I like to jokingly refer to as one of the fun states. But if we're still on the topic of taxes, one thing I do want to talk about is the annual earnings test. So what if you're taking Social Security income, you're younger than full retirement age, what happens to your benefit? Social Security has an annual earnings test where if you earn above $22,000 per year, then they're going to withhold $1 for every $2 earned above that limit. And then in the year of full retirement age, they're withholding $1 for every $3 earned above that $22,000 limit. In the month of the full retirement age and every subsequent month thereafter, no more earnings test. You can continue to work and you'll receive your Social Security benefit in full. And just want to transition over to the one big beautiful bill, the 900-page behemoth that's in the news. As everyone knows, there's some facts, there's some falsehoods around what's circulating around the actual legislation. So I just want to pass it back to Arash and Scott if you have any commentary here.
Thank you, Henry. Yes, definitely the one big beautiful bill has generated a lot of news, and it can be concerning for a lot of people because there is a lot of talks about cuts and Medicaid cuts and such. But one thing to note is that there is no direct cost to Social Security benefits. One big beautiful bill does not reduce the monthly Social Security benefit. The cost of living adjustment hasn't been reduced, and the eligibility hasn't been factored in as well. So there is no concerns there that your Social Security cut is going to be done anytime soon. So you will continue to get your benefits. And as in regards to, one thing to, talk about is the fact that, with less tax tax revenue coming into the governments, the trust fund will be depleted faster. So that is a concern. Maybe down the line, there will be some cuts for the future generation. Probably if they're not going to raise taxes, at some point we should anticipate some sort of cut unless, this tariff does magic and brings a lot of revenue for the government. So that's something to be mindful of for the next generations, of course. And Scott, any thoughts on the other items there? We are talking about reduced taxation benefits. There is not going to be anything there. I think I covered the COLA as well. So one thing you can do as a planning aspect is to maximize your retirement benefit contributions to your 401k and IRA. So for those people who are in their 30s that are concerned, maybe down the line, there will be no Social Security for us. That is something to, be mindful of. So it's good to save more now, contribute to retirement accounts, and be prepared for that. But hopefully the Congress and voters will make sure there's some benefits for those younger generations.
Yeah, Arash, I would just reinforce that last piece, right? That's really important. We touched on that in an earlier slide about how the burden has shifted a bit because of the reduction in the number of pensions to saving more. And Chad mentioned before about just like planning for it not to be there. So although we don't know what it's going to look like come 2033, and if we're actually going to see this, or that there's going to be some legislative changes, you have the time and opportunity now to plan for that. And that point can't be stressed enough to really take advantage of not just maximizing your IRA contributions, but if you have the catch-up provision, if you're above 65, there's even there's so much you can do to help plan for it. And if it's all solved by legislation, then hot dog, right? Then you just walk away with more cash. And so it's a win-win.
While we're on the topic of legislation, if you could move to the next slide, please. So where did WEP and GPO go? And the tail end of the Biden administration, they got rid of WEP and GPO, two acronyms I just threw out at you, but the only one that you need to remember is BYE, they're gone. There's no more WEP, no more GPO. So what were they? Windfall Elimination Provision was something where if you were a public sector employee or somebody who worked in the public field or government office, like a teacher, anything like that, then you received a pension. But then there was this offset calculation if you were eligible for Social Security benefits that offset most, if not all, of your Social Security benefit that you were entitled to. That is no longer the case anymore. GPO or government pension offset, that worked somewhat like the WEP in reverse, where the surviving spouse, they received a pension from the decedent spouse, and then the surviving spouse's Social Security was offset partially, if not all, from the government pension offset formula. And why are we taking the time to talk about two things that no longer exist? Well, it's pretty simple. It's opened up a lot of planning strategies for folks that never accounted for this kind of income because they didn't know that they would be eligible for it. But it's going to take Social Security a long time. Our estimates that we read are anywhere from a year to 18 months to have the system circulate to everybody what their benefits are, how do they collect, what mechanisms are behind all of that. So be proactive again, reach out to Social Security, see what you're entitled to, and start collecting on that money that you paid into the system. So let's wrap up everything in the next slide when we're talking about Social Security and what is the best filing strategy for you. And to illustrate this, I have three different examples. I have for age 62, full retirement age, and age 70. So for age 62, let's say you're 60 years old, you're in and out of doctor's offices all the time, you have a cash flow shortfall of about $1,000 a month, you have a little bit of credit card debt, no one in your family's lived past age 72. Well, waiting until age 70, that's not going to be of any help. You're probably going to get income for only about 2 years. And waiting until full retirement age means that you don't really have any recourse on your credit card debt. You need to get rid of that now. Just take the money now, take it at age 62. And for full retirement age, assume you're in average health, you have some money socked away in the bank, no one in your family's lived past age 80. A fairly average case, and what we're alluding to here is that it would be better to take it at full retirement age, most likely. And lastly, let's assume for the age 70 case, you're 65 years old, you're in great health, you stumbled into Caesar's Palace in Vegas, and I'll let you fill in the blank for whatever stumbled actually means for you. And you hit the $3 million jackpot on the slot machine, the lights are going off, and everybody's taking pictures with you because you got that $3 million check. And I'm assuming you're responsible now, and you walk out of the casino and you ride off into the sunset and you're living on those winnings now. That's a pretty good cushion for you. Maybe you just retire and then you take Social Security at age 70. And what we have illustrated on this slide is the tool that our team uses to help you quantify in a simple 5 or 10-minute consultation. It's a free consultation for everyone in order to understand on a granular level what benefit is best for me, when do I take it, and why? How does it affect my cash flow? That's just a simple call with us. We'll sit down with you, provide you with the tools that you need in order to file with Social Security in style. So with that, I'm just going to pass it over to Arash to talk about Medicare.
Hey guys, before we do Medicare, I got one question. And although Keith didn't join us, I think a lot of people here have worked with Keith in the past, and I'd be remiss if I didn't address this question because it's his favorite topic, is means testing. So we had a question that came in pretty early, which is really how will the depletion of the trust affect the benefits? There's a lot of other questions in the queue, everyone. We will address all of those when we get to the end of these prepared remarks. I do want to make sure that our team can touch on Medicare. But I think this is an important one that a lot of people have questions and a few people have thumbs up. And it all leads to why Keith likes to talk about means testing, although he's not saying to take early no matter what. He's saying just wait until, but when you hear the government say it, get ready to claim. Can you guys talk about what that is? And I mean, even just some thoughts you have on what happens with the trust depleting?
Yeah. So with means testing, I know that that's a popular thing to consider. And when it comes to planning, I know Keith is on the side of taking it early. When it comes to Social Security trust depletion, there's some stats where in early, I want to say 2033, that's when it becomes more of a concern. But with Social Security, we're more in the camp that it's going to be around, but it's going to look a little bit different for our folks as far as how you collect. They might push back full retirement age instead of age 67. Now, maybe we're talking age 68 or 69. And then means testing, that just has to do with the higher earning folks, where maybe that might revert back down to a mean or average with how much they can collect based on their income. So very real things that we need to think about and consider, but we just base everything on current law right now.
Yeah, I mean, so to reiterate what that means is if you made more money, they might reduce your benefit because you
Hmm.
should have been a good saver. Even if you weren't
Yeah.
a good saver, maybe you lived lavishly and did a lot of vacations. I love
Hmm.
to travel. They said if you made enough money, you get less benefit. And if you weren't a great saver, potentially you get more benefit.
Hmm.
But it really comes down to it is a real conversation. Yeah, I think Congress and
Mhm.
all the legislatures out there have a hard time talking about this stuff because it's such a
Yeah.
touchy topic for so many
Hmm.
people. And at some point, something's going to have to change, right? And it's
Yeah.
probably a combination of things, right?
Yeah.
Reduce the benefit, push the age back.
Hmm.
Maybe like the max is at 72, but full
Hmm.
retirement age is 70 at some point in the next 20
Yeah.
years. So
Yeah,
something
Hmm.
will happen.
yeah,
Hmm.
Chad, it's important to reinforce Henry's comment there, right? Like, we have to go based upon what we know right now, and if things go as we understand them and there's insolvency in 2033, right now that reduction in benefits would be across the board, right? And
Hmm.
means testing, this conversation has been around for a while. I mean, this is kind of like the Yeti, right? Everybody's heard
Hmm.
about it, everybody's talked about it, but nobody's seen it.
Hmm.
And until, right, something actually happens, it's something to keep in the back of your mind, but act on what we know now and what laws are now. And then so many things can change the insolvency date here. So
Hmm.
something to think about, something to be prepared for. Again, going back to the first pro tip, save, save, save. You have time on your side to be saving now and have it become less of an issue.
Hmm.
Yes, definitely. Saving is one way to bring more certainty in your finances for retirement. And the fact is, people are living much longer these days. You know, when Social Security was created, it wasn't anticipating people reaching 100. And many kids born today gonna at least like half of them may reach 100. So it
Hmm.
is a fact that they may make full retirement age later on, and also the mean testing will be in place. You know, with billionaires of the world, I don't think they need Social Security. So, you know, some sort of mean testing makes sense. Although higher thresholds probably would be better. But
Hmm.
with that said, moving on to our second topic of Medicare. So, how do you qualify for Medicare? In this slide, we're going to talk about Medicare and the qualification for Medicare. So, individuals who have paid Medicare taxes for 10 years qualify for Medicare at age 65. You must be a US citizen or a legal resident who has lived in the US for 5 consecutive years, so 5 years in a row. You can also qualify for Medicare if you have certain health condition, or if you are based on your spouse's work record. So if you're married and you didn't work, but your spouse did, you could qualify based on their work record, as long as you meet three specific requirements. So if you've been married for at least 1 year to a spouse who qualifies for Social Security benefits before you apply for spousal benefits, then you qualify. If you're divorced but were married for at least 10 years, you could qualify. However, you would have to be unmarried. So you have to be single to apply for this benefit. So if you're remarried, you cannot apply for on your ex-spouse's benefit records. If you are widowed but were married for at least 9 months before your spouse died, you also qualify. As in the case with divorce, have to be single. So, although if you remarried over the age of 60, they still allow you to qualify based on your deceased spouse's records. So there's some qualification there, but for most people, if you worked for 10 years and you reach age of 65, you qualify for Medicare. Moving on to the next slide. So we just discussed the requirement to be eligible for Medicare. Now let's talk about the actual enrollment. So majority of people are going to know that they're reaching 65 and it's time for Medicare because they're going to get bombarded with insurance salespeople trying to sell them insurance products and help them enroll into Medicare because they get commissions out of that for the most part from the healthcare providers. So you're going to get a lot of letters and it can get confusing. So let's talk about this enrollment process. So there are a few key points that you need to be aware of for the process to avoid penalties and make sure you have coverage on time. So most individuals should consider enrolling during the initial enrollment period which is a 7-month period around your birthday month. So 3 months before your month of your birthday month, and 3 months after your birthday month. And during those times, you can apply and get Part A and Part B of the Medicare. So that is the initial enrollment period. Then we also have the general enrollment period. So if you miss that initial enrollment period, you can still apply and get the Part A and B of Medicare. And you can do this from January 1st to March 31st of each year. If you enroll in Medicare during that time, your coverage will begin in July 1st, and some late penalties may apply. But if you enroll during the initial enrollment period that we discussed, so if you enroll during the first 3 months, around that 7-month period, your coverage begins the first of your birthday month. If you enroll during your birthday month, the coverage begins the next month. And if you enroll after that, the coverage will begin 2 months later. So it's important to time this right to ensure your coverage begins and there is no gaps there. But let's say for some of you that are still working and will continue to work when you reach age of 65, you qualify for what is called a special enrollment period. So as long as you continue to work, you can delay enrolling into Medicare and not have any penalties. And even as much as 8 months after you leave your employment, you can still qualify for this special enrollment period where you can fill out some paperwork and show Medicare that you were covered under your healthcare provider at work, and you qualify for this enrollment period and avoid any penalties. And then you can get enrolled and sign up for Part A and B of Medicare. We discussed the importance of this timing because if you don't follow these directions and enroll in the timely manner for Medicare, you can get hit with penalties. And these penalties can stay with you for the rest of your life, basically. So Part B of Medicare has a monthly premium, and if you don't enroll on time, your premiums could go up by 10% for each full 12-month period that you were eligible for Medicare and you didn't enroll, and that will stay with you for the rest of your life. So let's say in 2025, the premium for most people is $185 per month. So if you didn't enroll on time, yours would be 10% more. And the following year, once the premium goes up to, let's say, $200, yours will be $220 because you'll have that 10% penalty. So again, it's important to enroll in a timely manner. Just remember, at 65, you will qualify. You have that 7-month period to apply for Medicare. And if you're working, you fall under the special enrollment period. Going on to the next page. So what is Medicare and what does Medicare cover? So Medicare can get a little bit confusing. So it's always good to reach out and get some help to make sure you understand all parts of Medicare, because there is a number of parts and it can get tricky, especially the first year when you're hit with all this information. So to simplify it, we're going to break it down here. First, we're going to talk about the left-hand side of the slide, the original Medicare, Medicare Part A and Medicare Part B. So Medicare Part A, the easiest way to remember is just for hospital stays. So Part A provides inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. It does not cover long-term care. So long-term care is a separate policy that you have to get if you need it. You can discuss with a financial planner and medical brokers to understand what long-term care entails and how much it costs. But Medicare does not pay for long-term care, but this Part A covers for hospital visits. There is no premium for Part A. So as long as you have paid your payroll taxes for the 10 years we talked about, Part A is free and you cannot be denied coverage. So it just covers everything that you would need when you go to the hospitals. And then we have Part B. So Part B is for doctor visits. It helps cover medically necessary doctor services, outpatient care, home health services, medical equipment, and other medical services that you may need. Part B also covers preventative services. So you pay nothing for most covered preventative services when you have Medicare, and Part B will cover that. But for Part B, you pay a monthly premium. That monthly premium has to do with your income level as well. So for majority of people who are single and they earn less than $91,000, they will be paying 185, for example, in year 2025 that we're in. For married couples, that limit is 182,000. So if you're earning less than 182 and you're married, your premium would be 185. And if you're making more than that, there is a threshold. So for every income threshold, you pay extra premium for Medicare. So it's important to do some planning around that. So we help our clients who are about to retire or getting closer to that age to plan for this, because the premium could go up quite a bit if you're a high earner. And keep in mind that Medicare looks at your earnings from 2 years ago. So your 2025 premium is based on your 2023 earnings. So there is some work to be done around that. If you find yourself in different tax brackets or about to retire, because you can notify Medicare and tell them that you have a special event, and they will reduce your premiums based on the changes in your income. And so let's now talk about the other parts of Medicare. So this is the right-hand side of the slide. So once you enroll in Part A and B, which we discussed about hospital visits and doctor visits, there is a little bit of gaps because Medicare, although it's comprehensive, it doesn't pay for everything. You still have to pay deductible and co-insurances. And as you know, healthcare expenses here are very expensive, so it could add up to quite a bit. So because of that, to cover you for those deductible and co-insurances, you would have to get some additional coverages. So that falls, you have two options. You have Medicare Advantage plans and Medicare Supplemental or Medigap also there. That's goes hand in hand. It's the same thing, supplemental and gap. So you have these two options. So with the Medicare supplemental, you get those plans, and you would have to add Medicare Part D plan to it, which is for prescription drugs, or you go with the Medicare Advantage plan, which is an all-in-one plan. It's provided private health insurance, and it combines all these pieces. I'm going to get in more depth with these two on the next slide. So we'll cover what exactly these two options are and how they differ. So if we could go to the next slide. So let's talk about these two options. Again, Medicare, you have Part A and B, which is the original Medicare. And then to cover those co-insurances and deductibles, you have these two options. One on the left-hand side, Medicare Advantage plan, is an all-in-one package. Instead of your original Medicare, you sign up with a private insurance company that's approved by Medicare, and they cover your hospital care, doctor visits, and prescription drugs in most cases. Basically, Part A and B and D are usually covered. And then they also add on to them vision and dental, sometimes gym memberships, and it's just an all-in-one package. And it's very affordable for the most part. Sometimes there is no monthly premiums other than your Part B premium. Of course, you always have to pay that Part B premium, but for advantages, some plans have zero monthly premium. Some of them are from $20 to $100. So it can be very affordable, but there's always a catch when things are very affordable and cheap. So one of the reasons for that is that you have to go to their network. So you are limited to the network for doctor and hospital visits. And if you want a specialist, you may have to pay more out of pocket. And for special treatments, there may be longer waiting times, or you have to get approval. So it can be lengthy, and it also can cost you a lot more if you want specialists and you have major surgeries or procedures that needs to be done. So the pros of Medicare Advantage is a lot more affordable, all in one. The con is you're limited to the network, and if you do have major procedure, it could cost a lot more out of pocket. But Medigap policies, on the other hand, is a sidekick to the original Medicare. So you have your Part A and B, then you go to private health insurance provider, and which is qualified by Medicare, and you select one of these standardized plans. These plans are very comprehensive when it comes to Medigap policies. The for example, Plan G covers like 95% of anything that will come up in for your healthcare needs down the line. And they're standardized, so you can go to many providers and it gets added to this. And they basically what happens, you pay this monthly premium every month, somewhere around $100 to $300. So it's more expensive than Advantage, but you're covered for all your deductibles, co-insurances. They pay for almost 95% of your expenses if you get one of those comprehensive plans like a Plan G. So, and also it gives you the freedom to go to any doctor or hospital that accepts Medicare. So as long as a doctor or hospital accepts Medicare, you have this additional coverage with the Medigap or supplemental plan. They cover all your expenses. So your costs are very predictable when it comes to your healthcare costs down the line. But the con is that it's more expensive than Medicare Advantage plans. You have these higher premium that you have to pay on top of the Medicare Part B. So Medicare Part B, you still pay the $185. For this supplemental plan, you pay somewhere around $100 to $300 a month. But then this is your cost for the rest of your life, and it goes up, of course, every year because of inflation. And then on top of that, you would have to add Part B for prescription drugs. So as you can see, the cost could add up monthly. It could get more expensive, but it's very comprehensive. So some folks that may have health conditions, it's something to consider because then you at least know this is your cost for monthly basis and you don't have to worry about any extra costs down the line. So a lot of our clients, when they come to us, these are the things that we take into consideration. It depends on your needs, if you mind going to a certain network or not. And, if you want to have the freedom to choose your doctor, if you're okay with the cost, these are things to consider. One thing to keep in mind is that when it comes to these Medigap plans or supplemental plans, when you're during the initial enrollment period, that 7-month window that we talked about around your birthday at 65, you can enroll in any of these plans, and there is no underwriting. So these insurance companies can't deny you coverage because of a pre-existing condition when you're signing up for these Medigap policies. But that's just during the initial enrollment period. So if you have a health condition, we generally, if you can afford it, suggest going to a Medigap policy, supplemental policy, because there is no underwriting. You can get the coverages and everything you need, and down the line, if you see it's expensive and you don't need it, you can downgrade to a more affordable plan. However, if you go into a Medicare Advantage plan, let's say, and down the line you decide that you have these issues and the cost could add up because it's not all covered at the Medicare Advantage. If you go to a Medigap policy or supplemental policy, they'll put you through underwriting and they may deny you coverage. So there's something to really keep in mind for those individuals who have health issues or have that history in their family, that this one time no underwriting in initial enrollment period, I think is very important and something to keep in mind. Again, these things can get very confusing. There is a lot of information I shared here, so feel free to reach out when the time comes. We will talk to you, walk you through this, and connect you with a Medicare specialist if you need it. So with that being said,
because I know you're about to do like the OBBBA factor fiction on Medicare, but I know we're also at the top of the hour. So before you get to that, I think that's Arash's last slide on Medicare, other than sharing resources and contact information at the end. But the links I have, like one is that survey that we always post. One is also a PDF link to today's slides. My understanding is Zoom does not allow you to copy links out, but if you do just click the link, it should open up in your browser on another screen for you, and then you can access those later. There's also a link because this is a really quick overview from Arash, 20 minutes on Medicare. Like I said, we did one mid last year during our summer series. We do Medicare or Social Security every year, and that was an hour of comments and an hour of Q&A on just Medicare. There wasn't even a Social Security component to that. So that's that link with Brian MacArthur. I did also post a link to the first webinar we did in this series on July 10th that touched on long-term care insurance, just because Arash mentioned long-term care insurance is not covered by by Medicare. So if that is something that you're thinking about, definitely check out that webinar. Brian MacArthur actually talked on that exact discussion as well. And then just because I know there was a couple questions on how to time your Social Security payment and when will you get the first payment, I posted a link to the Social Security website in the chat box as well that kind of tells you when you can expect it. I mean, you can expect it, they say about a month later, but I think most people say probably 2 months later. But you can register up to 4 months before the date you're hoping to receive your first check. So that link would actually, it's from Social Security Administration that would allow you to at least estimate when you should really enroll based on when you're hoping to start collecting Social Security. All right, back to you to wrap it up on Medicare, Arash.
All righty. Thank you, Chad. Again, one big, beautiful bill. There is a lot of concerns there. I think Scott and Henry were going to chat about these facts versus fictions.
Thanks, Arash. I'll touch on the top row, Henry, if you'll do the bottom. Again, fact or fiction. So no cuts to Medicare benefits. So the act does not reduce. So there's no language in it that would reduce Part A, which is hospital, Part B, which is medical, or Part D that are drugs. So there is no language in it that would call for cuts to January Medicare benefits. The reduced taxation lowers funding. This is a very similar story to Social Security, right? So there was a part of the bill, what's called the senior deduction, $12,000, and that's defined by 65 years of age and older. So it does decrease taxation on Social Security, railroad retirement benefits, and so forth. So it does cut the trust fund down by about $30 billion a year. And so this could have the same implication around 2032, looking at insolvency. The delayed Medicare savings program. So this program is designed to help low-income seniors with premiums. Much of this was delayed until 2034. And the other component of this is just maintaining stricter eligibility for eligibility checks for those who apply. And then the last one, there's been quite a bit of noise here around non-citizen eligibility. Medicare is limited to U.S. citizens, lawful permanent residents, and a couple of smaller groups. But it does exclude other lawfully present non-citizens, even if they've made contributions through tax payroll taxes. So that is not a concern because those folks were not eligible in the first place. Henry?
Yeah, for physician payment adjustments, all that we're really referring to is that there could be a potential reduction in doctor availability for rural areas. Think places like northern Idaho or central Wyoming, just because the projected increase in cost to continue facilitating the program in the future. For AI fraud reduction, we're just talking about AI to detect improper Medicare payments as mandated by the One Big Beautiful Bill to do so. And that's just strengthening the strength of the program and sustainability without affecting your benefits. And just a planning tip for everyone here, do what you can to maximize your retirement contributions or just general investment account contributions to account for the offset and potential future Part A cost increases. The thing when we do a financial plan that's most concerning for whether or not a plan works or not, to be honest, is the rising cost of healthcare and one's ability to continue paying for that. So make sure that you do what you can to build up that nest egg and build up that cushion to account for the rising costs of healthcare.
Yeah, don't forget the health savings account contributions, right? It's portable. This is a great vehicle for that. As well, when you think about planning and additional contributions, don't forget about the HSA. All right, so to close it out again, some additional resources that we wanted to put up here and provide for you as well. Chad, it's back to you, my friend.
Thank you, gentlemen. As a reminder, all of the resources, I think I probably said I put them in the Q&A box, but I posted those links into the chat box. They will all be distributed by our team via email tomorrow to everybody that has attended the event. You should get two. Actually, you should get an email from Zoom that usually only includes like the survey link and the replay link. It's not a fancy email. Zoom doesn't let us do a lot, so our team always sends out a secondary email that we can make it look a little nicer and include as many resources as possible. So you'll get the link to the replay, both on demand or via YouTube, whatever you prefer. There'll be a link to the PDF slides, so you can have all the resources in the slide deck these gentlemen used today, as well as a link to those replays that are already on YouTube from previously, and the link to estimate, timing your benefit and when you should take that. So with that, again, all the contact information is attached on that screen. Thank you, all of you, for attending. Gentlemen, we have over 30 questions in the queue already, and they're still coming in. Let me go to the one that has the most votes right now. And it came in, quite a bit ago on Social Security. I'll go back and forth trying to lump some together where they make sense. If you're getting Social Security payments at full retirement age, but you're still working and your income goes up, will they adjust your Social Security payment by averaging your income again each year?
So I think Henry touched on this. So if you're at full retirement age, your income your Social Security benefits will not be reduced. You'll just, if you're making over those thresholds that we talked about, you're just going to have to pay tax on the Social Security. So let's say you're married and you're making over 44,000 in aggregate, including your income, 85% of your Social Security would be taxable. So you're not paying 85% on Social Security, you pay 85% of Social Security income you receive will become taxable, just as all your other income.
Hey, but I think what this question is getting at, because I think that's a good response too, is will they use future years' earnings in that the 30-year calculation that you guys referred to and potentially adjust your benefit? Because this is not, it's not saying their benefit would go down, but what if they made more money in retirement? Maybe somebody starts consulting and they were making $50,000 now and now they're making $200,000. Do they adjust up over time?
They'll just up the average from the earlier slide that Scott went over on how that gets calculated. So that average keeps ticking as long as you keep working.
Yeah, and the caveat is, they determine every year what the maximum benefit is, so you won't be able to go above that. So for 2025, if you're under 5108 a month, that's where it'll stop, at least for 2025.
And so I have another one just from somebody. I'm going to actually type it in the Q&A box to respond to them. But somebody else, when to apply? You want to apply for Social Security, about 3 to 4 months in advance of the date you're hoping to start collecting Social Security. It's going to take a couple months for them to send you your first check.
Yeah, and I just want to add a little something to that. They might ask you if you want retroactive pay when you're doing that, or retro pay. If you hear that phrase, 9 times out of 10, it's probably not appropriate, because what they're doing, assume it's full retirement age. That is what your intent to do when you go in to file. Then if you're asking for retro pay, they give you a lump sum in order to tide you over until your payments begin in full retirement age. But they're being a little sneaky in what they're actually doing. They're giving you full retirement age minus 3 months in this scenario. So if you got some credit card debt you need to get rid of, or some other extraneous circumstance and need that lump sum, it might be appropriate. But again, 9 times out of 10, you want to say no to that lump sum and that retro pay question.
Yeah. I'm going to come back to one on Social Security in a minute, but this one has quickly gathered quite a few votes. Are all doctors required to accept Medicare?
No, I don't believe they all require it, but I've heard most people do accept Medicare. My understanding is.
Yeah, it's not a requirement.
Yeah, I think that most do, because it pays well. Yeah, I think one of the things you hear from one of our really great networking friends, Brian MacArthur, who helps with some of these presentations, and that link I shared for last year's Medicare presentation is for most people. It's not always the case. Some employers pay really robust medical benefits, and if you're like a 90/10 or 100% coverage, like maybe your current, if you stay employed, is better than Medicare. I mean, he'd still tell you enroll in Medicare, but just keep your in job. Right? But at least roll in Part A at 65. But he says really for most people, even if your employer pays a pretty significant piece of your premiums, that the benefits from Social Security or for Medicare are just so much more robust if you enroll in the right programs for your situation. And it's really rare that he finds somebody that would do better off on their employer's benefits. And there is like Arash talked about, there are some of them that are kind of operate like a PPO. There are some of them that operate like an HMO, right? So maybe you have to use only network. Maybe you want any doctor that you can find that accepts Medicare. There's different options within the Medicare framework to really allow you to pick the doctors you want to work with, right? So like, I think HMO is like having Kaiser and you can only use Kaiser no matter what. PPO is saying, well, I don't know anybody at Kaiser, but I might want to use UC Irvine or Hoag or, St. Jude's or something else. And just having that flexibility, you have those options if you have some preferred providers that you want to work with and check out.
Mhm.
Okay, so the next one I have, and this is on Medicare as well, before I go to Social Security, is if we keep working, do we waive Medicare or is it better financially just to enroll?
You could just enroll. There is no, downside in enrolling, and you get Part A. And when the time comes that you get off your employer's benefits, you get enrolled in Part B, and you start paying it. It's just that you may not want to pay for Part B because you're already covered, and the Part B premium is 185 per person, so it can get expensive. But there is no downside of enrolling. It becomes like a secondary to health coverage that you have.
Yeah, and like I just mentioned, at least check. Like, is enrolling and signing up for Part B better than your employer benefits? Because in many cases that is the case. Okay, so back to Social Security here. The question is, did we say that as a full retirement age, you can work and earn as much as you want and still receive your full Social Security benefit? And if so, is that regardless of what age you start taking it?
So the annual earnings test that I was referring to earlier in the presentation has to do if you were taking your income before full retirement age and you're working and you're before full retirement age. That's all that's applicable to. And if you get to full retirement age and you're still working, then you don't have to worry about that. You can earn as much as you want or whatever your job is earning, and you're receiving your full Social Security benefit. So it's only applicable for that couple of years before full retirement age if you're working, if you're taking income.
Okay, next question I have here for you is if you don't plan to use Medicare, do you have to apply every year after 65 or just when you turn 65? So I know there are like late enrollment penalties and stuff like that too that to keep in mind.
So if you, could you repeat that? Sorry, Chad.
Yeah, so say you're not planning to use Medicare, I mean, potentially at all. Do you still need to apply every year after age 65, or you just apply once when you turn 65 and you're done?
You just apply once when you turn 65, just to avoid that 10% penalty that's going to get added to your premiums.
Yep. So the next one I have for you is when you sign up for a Medicare Advantage plan, so for example, like a Kaiser, do you actually relinquish your Medicare benefits to Kaiser?
Mm, No, I mean, what you're doing is you're not relinquishing the benefits, you're just electing which institution you're wanting to go through. And it sounds like you have a more nuanced situation. So we're always happy to send information for Brian MacArthur's contact info to meet with you offline to see how you can go forward with that.
Yep.
Mhm.
Okay, so next one I have is are the income thresholds that we've been talking about, based on when this came in, this could easily be, I think this is actually Medicare, but I might apply it to Social Security too. Does it also include pensions and 401k distributions?
I
Yes.
Yeah, I believe what they're referring to is the Part B and D premiums and how that gets impacted from your total income and how it gets impacted through Medicare premiums for Part B and D. So what we're referring to is IRMA or the Obamacare surtax, if you're familiar with that terminology. And that is a 2-year look back on all of your modified adjusted gross income. So that's going to include things like 401k distributions, your pension income, Social Security income. Everything is included in that calculation. And again, it's a 2-year look back for that adjustment. There's also what you can do if there's a one-off event, say you sold a rental property, had a big capital gain, and you had an unusual tax year, then you can go to the Social Security Administration file form, I believe it's form 44, and then claim that you had this one-time exemption, and then it's up to them to say if they're going to accept that or not. So you also don't want to be proactive in that when you see that increase in your premium for Part B and D. Wait until that actually happens to then file the form and then see what you can do from there. But to answer the question, all of your income sources do impact your Medicare premiums.
Yeah, and just because we have awesome attendees, I'm going to share one before I get to the next question. This person's just talking about their spouse is on Medicare Part A and also on her private insurance, which is a PPO. Says it's expensive, but this person has extensive health issues and it makes it really affordable. Right. So like I said, having the flexibility and the options to use whichever one you want could definitely be the right way to go. Okay, next one I have for you, gents, are just understand, can someone collect Social Security and still work before we reach your retirement age? The answer to that is yes. Social Security might reduce your benefit, but they actually true it all up when you actually start, get older too. So, when you hit full retirement age. So yes, you can still work. There's implications from it. You think potential tax issues and benefit reduction for a short period of time, even though they make it all up to you down the road, you don't actually lose the money. That you definitely want to talk to a financial planner and your accountant and make sure you're making the right decisions for yourself and your situation. So this one gets into, I love it. So they're not all on just issues with their questions. Some of this is, there's maybe a move, and I think this gets to privatize Social Security. If that happens, like, how would that even work?
Good question for us healthcare providers. I'm not exactly sure how it's going to work. There's a lot of moving pieces there on how this whole thing is going to play out, if they can make any changes.
Yeah, I don't think that there's nothing formal being discussed other than just the idea of it. But it hasn't gone to the planning or figuring it out stage on how it's actually going to work. So I don't believe I've heard anything around logistics.
Yeah. Okay, next one I have for you all is this is with Medicare and HSAs. If planning to work beyond age 65 with an employer plan, should one stop their HSA contributions early to avoid penalties due to the look back coverage?
Yes.
Sure.
That one's pretty straightforward. You have to stop.
Yep. So next one is it best to enroll in premium free aid at 65, even though one plans to continue working with the employer plan? I think we addressed that one already a couple times. It's absolutely, yes, definitely enroll in at least Part A, even if you're not going to use it. So what is the age where you can earn and receive full benefits without taxing? This goes to Social Security. Like without being taxed. I think we had a slide too. If you want to go back to that, Scott, that could help explain it.
It was the what age?
Yeah. So it has to do with, in general, what your income level is. I believe it's slide 10 if we want to look at combined income. Then we can just show how that calculation works.
Share your screen back again.
Yeah.
It's coming.
Yeah, no problem. So while that's loading, I'll just talk through that Social Security not taxable side. If you're individual under 25,000 or married under 32,000, then your Social Security benefit is not taxable regardless of your age. But again, we're looking at your combined income. So again, your adjusted gross income, which is factoring in anything like retirement plan distributions, your income sources, and some non-taxable interest, municipal bonds as an example, and then half the Social Security benefit. So then if all of that together is under 25,000 or under 32,000, then your Social Security benefit is not taxable. And if your income is frankly that low, then you're probably using the standard deduction and you're probably not paying any tax at that point regardless. But again, I'm speaking in generalities. If we're looking to get more granular, always happy to do that offline. But that's what's going on behind the scenes if you're looking to see how the taxation of Social Security works.
And just one thing to add to that, I think Henry made a great point. If your income is low and you have the standard deduction, keep in mind in 2025 to 28, with the one big beautiful bill, they have this extra bonus deduction of 6,000, which is really meant to be for seniors making over 65 to reduce their Social Security taxes, because Trump wasn't able to actually waive taxes on Social Security. What they did is that they brought this extra bonus standard deduction for those over 65 so they can reduce their income and essentially pay less in Social Security taxes. That was one way around it. But if you're in a lower tax bracket, you have the standard deduction, then you have this bonus deduction, so your taxes will be much lower, if any.
So the next one I have, this goes back to Medicare. Does Medigap include dental and vision coverage?
Glad you brought that up because I forgot to mention that the Medigap policy, so you get Part A and B from Social Security, and then there is those gaps, right? You got the co-insurance and deductibles that you have to pay. So if you sign up with Medigap policy, that helps to cover those in co-insurance and deductibles, but it doesn't provide you vision or dental. You have to get separate policies for that, along with prescription. Prescription, I think, is very important, and every year you have that open enrollment. You can, depending on the drugs that you're taking or medicine that you need, you can get an appropriate plan every year and update that. But vision and dental is not covered by Medigap. You have to get separate policies for that. And in some cases, you might be better off not having it because they don't cover much anyways. So sometimes it's not worth it. Sometimes it is. So it depends on your needs and your comfort level of paying out of pocket when the need comes, or whether you want to pay something monthly and then get that coverage. Because some coverages are up to, for example, $2,000. And if you're already paying 100 something in premiums every month, it may not even make sense to have vision and dental in that period. But to answer the question, Medigap does not cover vision and dental.
So next one I have for you is, according to Medicare documents that this person's received, every hospital visit is going to cost about $1,600, even though you don't pay the premiums. Does that sound about accurate from what you've heard?
I would want to read the documents before making a comment like that in generality, but I mean, it's possible. And I know Brian MacArthur, he likes to joke that Part A covers going to the worst hotel stay in your life, going to the hospital and utilizing Part A coverage. So 1,600, even if you don't pay the premiums, it's plausible. But again, I would like to read that before confirming.
Awesome. Next one I have is, where can I find, or who can I contact to find information available for supplemental coverage? Like, is there even people out there who can supply me with different choices and who's not pushing their best interests? I would definitely, especially if you attended the long-term care insurance and you saw Brian MacArthur's contact, we will include it in our follow-up email that comes out tomorrow as well. I can tell you, I don't know from the three of you that you all worked with, but I know Keith and Paul have worked with him extensively too. We've never heard anything negative from any of our clients with Brian. He does make commissions. He is not a BFSG employee. He's not affiliated with us. I think what we learned when talking with him, though, that you could take his advice and go buy your insurance, your Medicare yourself, and it's going to cost you the same, right? The insurance providers, they pay him a piece of your premium as a commission for bringing them the business to you. I think one of the reasons that our financial planning team loves working with Brian so much is that we are fiduciaries. We sell no products at BFSG, and even though Brian can make commissions, he treats all relationships as if he was a fiduciary too, and that's the feedback we get from most clients too. So I definitely would look for that email tomorrow if you do want to talk to somebody that you can get really in the weeds and show you the differences between the different policies and really help you understand which ones might make sense for you based on your really personal situations. Because I think he's been a great resource when somebody wants to go above and beyond what our financial planning team is able to offer.
Yeah, Chad, also behind that question, another component is, the pushing their best interest. This is really a question of whether or not you go to an agent or a broker. And an agent is only going to sell their company's products, right, that they're affiliated with, where a broker will look at all products regardless of who issues them and try to find the best one for you. So as you go out there, that would be an important question to ask, so you could feel better about someone acting in your best interest versus theirs, a broker.
Okay, gentlemen, the next one I have for you is, this is Medicare still, can you change from Medigap to Medicare Advantage and or vice versa? I know there's restrictions going, certain directions. What are the rules between going back and forth from those?
So every year in an open enrollment period, you can switch, but as I mentioned, the most important factor in this decision is your health needs and underwriting. So during the initial enrollment period, so when you turn 65, during that 7-month period that you can pick anything you want, you have the option of going Medicare supplemental Medigap policy and get the most comprehensive plan, let's say Plan G, for example. These are standardized plans. So these are standard plans. The coverages are all standardized. So every healthcare provider that you go, United Healthcare or CVS or whatever, they all provide the same benefits because these plans are standardized by Medigap. And you can enroll in any of these, and the insurance company is not going to put you through underwriting and ask you about your pre-existing condition. They have to give you the plan that you're choosing as long as you can afford to pay it. And then, so that's important because then you can downsize to a Medicare Advantage plan if you don't like it, or go to a cheaper plan, supplemental plan. But after the initial enrollment period, let's say during the initial enrollment period, you went with a Medicare Advantage plan, and then you want to, substitute to a Medicare supplemental plan, which is more comprehensive, they will put you through underwriting and they may deny you coverage. So you could switch up the plans whenever you like, but there may be underwriting down the line outside of initial enrollment period. So it's important, if you do have pre-existing conditions, or if you do have a history of certain diseases, or let's say cancer in your family, and you may have some extra costs down the line, if you can afford it, it's perhaps more wise to go with a supplemental plan. Again, it's best to talk to a financial planner or a professional just to review all your circumstances before making a decision. But the underwriting is the main factor to remember when it comes to this.
Okay, the next one I have for you all, this goes back to Social Security. Can you jump back, Scott, to page 8? It was the break-even slide. For the break-even chart, so the answer to the question is yes. It assumes no investment gains for early money taken, nor tax consequences associated. So this is just calculating like the actual cash that you would receive from the Social Security Trust. So I think where this is alluding to is, well, if I start taking at 62, the amount of dollars I would have received from the trust might break even from the 66 at age 77. But assuming you don't need the money, like maybe you have a pension plan, or maybe you have plenty of 401k assets and other savings and investments, if you were to take every dollar you receive from Social Security and invest it instead, that would honestly, it would push that break even back, because you are getting money from Social Security Trust early, and if you're investing it, maybe that break even moves to 68 or 69 years old. I think it goes back to something Henry mentioned earlier too, is that the average increase in your benefit from 62 to 66 is around, it's like 7-8%. I think it's like 5% the first year or two, then it's 6.5%. Eventually it's 8% for the last 3 years between 67 and 70. When you put it in perspective, the average gain on that is 6 to 7%. I think most investment professionals would say over the next 20 years, you're probably going to make somewhere between 4 and 8%. And this is a guaranteed 7 or 8% for waiting for that 4 to 8 year period. I don't know, even our own investment professionals that manage at BFSG are going to give you that exact same stat. Like their goal would be to make you that 6 to 8% over time. And some years are going to be up 20 or 30%. Other years you might be down 20 or 30%. And this is a guaranteed increase to income. But yeah, I do like the question. This does not take into account the investment gains. It just gets to, would you really do better than 8% every single year? Anything to add to that, or was that acceptable?
Oh, that was great.
No, that's clear. Yeah.
Cool. So this is along the same lines. This person, I'm going to do two similar to this too. So I'm planning to collect at 66 and 10 months. That's call it end of November.
Okay.
I turned 67 in January. Is waiting that 2 more months enough to increase from 100% to 108%, or is it a full year after they, hit
Mhm.
age 66 in 10 months?
Yeah, so it's a sliding scale. So they're tracking that on a monthly basis. So full retirement age in 2 months in this scenario, that would just mean you have 101% or so of your benefit and et cetera. So they're tracking that on a sliding scale. Mhm.
Yeah, so I mean, in short, your
Yeah.
benefit does increase every single month, but you won't
Hmm.
get to the
Yeah.
full 108 until a full year after you hit age 66 in 10 months.
Hmm.
Yeah. So just I have a similar one to that, not quite the same though. I mean,
Yeah.
assuming this person's birthday, beginning of October,
Hmm.
for the IEP is 3 months after the birthday, like which would be called the end of January. Is that when they need to apply?
So it's recommended that you go in early just to make sure you dot your T's and cross your I's, so to speak, to make sure all the paperwork's good. Not required to, but we do recommend about 3 months or so before you plan to start collecting Social Security. Mhm.
So next one I have is, does a person need to be eligible for Medicare before spousal benefits apply?
Yes, I mean, you have to be 65 if that was the question, if I understood that correctly. To be eligible for Medicare, you need to be 65. So,
Mhm.
Yep, awesome. Okay, so next one I have is to clarify my understanding and of the Medigap policy is separate from Medicare options. Am I responsible to find a Medigap policy, or is it an option when I'm going through the Medicare sites with the government?
yeah, so when you with the government, you would apply for Part A and B. So that's with Medicare, and then this is a separate policy you would have to get with a healthcare provider with the supplemental policies, and that as we mentioned, Medicare brokerages like Brian can help you decide which plan to get, and most of my understanding is their commissions from the healthcare providers, so it's nothing that they're going to push one way or another. But so they look at your situation, help you make the best choice, but it's separate from A and B. That's through Medicare.
Mhm.
Yep. So I think this should be a fast one, but it does have a vote again.
Mhm.
And I think we addressed it, but does taxability of Social Security continue after full retirement age?
Mhm. Yep. It
It
continues
does.
to track the rest of your life. Mhm.
Yeah. I think Henry mentioned too is that, I mean, he mentioned a very specific word, federal taxes.
Yep.
I think I
Mhm.
did Google it. It is a quick Google search. I think their AI will even summarize it in Chrome. I think
Mhm.
there's it's only 9 or 10 states that do tax. But so definitely keep that in mind. I think New
Mhm.
Mexico is one of them. People think of New Mexico as a low tax state. So definitely
Mhm.
think through if there's a state tax implication based on where you might be planning to relocate or live in retirement.
Mhm.
Next question I got for you is if there are pension or physician payment adjustments,
Mhm.
isn't there potentially like fewer medical groups willing to accept it, like Medicare?
Yeah. And that's somewhat what I was alluding to, but of course, like with any large government program, it takes years for that to actually understand the fallout of that. But when I'm just pointing out, if things are getting more expensive in order for doctors to provide care, then there might be fewer doctors willing to want to do that type of care. So that's what I'm alluding to. The government, I would like to think, knows and understands something like that. Because if there's just more people in general that need Medicare coverage or Medi-Cal, Medigap coverage, then there's going to be a need for doctors in there. So it'll be one of those things that probably balances out. So I don't mean that in a way to scare anybody on the call, but just that is the reality of the situation. That's all.
Okay, I got two back to Social Security
Yep.
and the spousal benefit.
Hmm.
The first one I think is just easier. Does your spouse need to have 40 quarters of work to claim spousal benefits under Social Security? Like, do they also have had to work for the 10 years plus or minus?
No,
I don't
the
believe there's an eligibility requirement for the spouse to claim spousal benefits, other than the 10 years of marriage, and still unmarried at the time of the claim. Henry, are you familiar with that? I've not heard that before.
that's right. There is
Yeah.
not, sorry, jump in, Henry, but go ahead.
No, no, I was just going to confirm that. That's all. You can go. Mhm.
Yeah, there is no work requirements as long as you meet those spousal
Yeah.
requirements that we mentioned. The spouse doesn't need to basically work. They would get qualified for half of the working spouse's benefits. The half would be half of the full retirement age benefit that they would be receiving. So.
I think the
Mhm.
one thing I'd add is just be leery of this if you've been married a long time and you get divorced and are thinking about getting remarried. There
Yes.
might be things to think about.
Mhm.
Yeah, and just a bust of myth also that's very common is it doesn't reduce your former spouse's benefits by half.
Mhm.
They still receive what they are able to receive, but you are eligible for up to half of that amount that they would receive. So you're not taking it away from them. You're just eligible for half of their benefit.
So the next one I have here is on the similar topic, but if your spouse takes early Social Security and you take at full retirement age, then your spouse passes away before you take your own. Do you get both their 50% and 100% of yours, or do you just get to pick whichever one's larger?
No, so when your spouse dies, then the surviving spouse either gets our own retirement benefit or the survivor benefit, just whichever one's higher. You unfortunately don't get both. And where I was alluding to earlier on the presentation, just be proactive with that and sit down with Social Security to see what's going to be the better option for you.
Okay, next one I got here is the restricted eligibility for non-citizens has been talked about since the 80s. One of the reasons that this person finally became a national citizen over 10 years ago. Uh, Part of financial planning, is that something to think about if you're, not a citizen? I think this person went through
Uh,
financial planning and realized that they should actually go through the process.
I mean, it would qualify them for Medicare at that point. So if that's if the reason is to be eligible for Medicare, then that trigger would have to be pulled, so to speak.
So I got one more in Q&A. There's a couple in the chat box that I'll read after, especially because I see that they're actually still on the call today. But can you get independent HSA account if your employer doesn't offer it? And why would it? I mean, this person's really wondering why their employer wouldn't offer an HSA if they have an FSA, but that just comes down to how they're paying for health insurance and what provider options are available to them.
Hmm.
But like this is obviously somebody that's not Medicare age yet. They're just thinking about
Hmm.
benefits of
Yeah.
HSA and how great of a
Hmm.
tax vehicle they can be.
Yeah.
How easy is that?
Yeah. So to answer the question, you can. There's some benefits that are available if you do have it through your employer, where you have it through paycheck deferral. So you can contribute to the HSA. You can still get some tax benefits from doing so independently, but you're losing out on the FICA and FUTA taxes, which just have to do with unemployment taxes that come off of your paycheck. So it's a little less tax advantageous, but you can do an HSA, but you have to be part of a high deductible health plan. So as long as that is met, then you can do that. And then HSA and FSA are two different types of savings accounts. FSAs, there's things like dependent care FSAs where it can pay for daycare expenses, things like that. It's more like apples and oranges than anything else. So if you do have more questions on HSA versus FSA, I'm always happy to meet with you to talk about that. Mhm.
Okay, next one I have for you is, let's go to the chat box again. What's the extra premium that you mentioned for a married couple earning over $182,000?
So as you
Mhm.
can see, it gradually goes up. So for those earning under 212 married couple, it's 185. And these brackets change every year. So depending on the tax brackets may adjust for inflation. So under 212,000 for married couples, the premium is 185 per individual, so each. And then for married couples from 212, earning 212,000 to 266. It's the premium is 259, so it roughly goes up by $75. But as you can see, it goes up as your income goes up to 750 and more. So it can be substantial for those making a lot of money. The premiums could add up per individual.
So last one I have for you, unless one more comes in, is if you're over age 65 and you only signed up for Plan A, because you happen to be on your spouse's, company's insurance still, are you still able to change to Medigap without underwriting? Or do you have to qualify at your initial enrollment in Medicare Part A?
For that, you're not really required to sign up for Part B when you turn 65. You just have to show that you have credible coverage at this point and have an active employer plan you're part of. And then there's a special enrollment period, which maybe that's what they're referring to when they mean initial enrollment. And then there's no medical underwriting if you enroll in Medicap within 6 months of that time period.
So you fall into the special enrollment period, and what happens is that you get a document from your employer that shows that you were covered under the employer's plan. You provide that to Medicare, and you qualify for that special enrollment, so it avoids any underwriting.
Yep.
And we did get another one in group. This person is about 3 months from being 65, planning to apply for Medicare soon. Their spouse is younger than them. Can the spouse apply for Medicare after this person's accepted? Because that's just when the spouse turns 65. Is that accurate?
Right.
Yeah.
Yeah, there's no requirement for you and your spouse to enroll at the same time, right? You're enrolling based on your age and your timeline, and each of you would be doing that independently.
Yep.
Awesome, gentlemen. That's the last question we have for you today. Any closing remarks from the three of you before we wrap it up?
Thank you all for taking the time today. And if you have any other questions, we're here to help, and we can go through that Social Security Analyzer tool or just get into the weeds with Medicare. Always happy to do that. Thank you all for taking the time.
Thank you.
Yeah, thank you.